In this standard of care, this version 8 document, doctors are actually encouraged to tell people who are suffering from gender disorders, not just people, but children even who are suffering from gender disorder, to bind their chest. That is, to take a tight wrap to camouflage your breasts, to flatten them so that you don't look like you have a woman's body. Doctors are told to encourage children to make sure that they know what genital tucking is. Genital tucking, this is graphic, I know. If you have children in the room, you might want to turn this down or put it in your ear for a moment. Genital tucking is exactly what it sounds like. When young men are not only taught how to tuck their penises between their legs, but actually push it back up into their body. Now, this may be an obvious thing to say, but in this day and age, obvious things need to be said. This can be very dangerous for young men. And the reason that WPATH wants doctors to enlighten young girls about chest binding and young boys about genital tucking is purely because they want children with gender disorders not to be misgendered. So this has nothing to do with healthcare. It has nothing to do with medicine. It has nothing to do with the treatment of gender dysphoria. It has everything to do with politics. WPATH also advises healthcare professionals to push back on parents who are not supportive of transing their children. The word that WPATH uses is challenge. Doctors are supposed to challenge moms and dads if moms and dads don't want to put their 7-year-old boy on medication, hormone blockers that would chemically castrate him. When it's possible, WPATH tells doctors it's totally fine, sometimes even recommended, to prescribe puberty-blocking hormones to children without parental consent if it can be done. Again, this is not about medicine. This is not about science. This is the politics of the thing. And doctors across our country, medical providers across our country are going to be forced to comply. When it comes to the actual mental health aspect, people that suffer from gender dysphoria or other gender disorders, the majority of the time have significant comorbidities when it comes to mental health care, whether it's anxiety, whether it's depression, whether it's schizophrenia, whether it's bipolar disorder, serious mental health issues. And yet WPATH does not recommend mandatory counseling, even for children and adolescents, young people, before undergoing transing, whether it's hormones or surgery. They said that should never be made mandatory. That should just be optional. Again, remember the statistics. When children who suffer from gender disorders are not transitioned socially or medically or surgically, oftentimes, the vast, vast majority of time, over 90%, those children recover from their gender disorder by the time they reach adulthood. But of course, part of that is getting the counseling and the mental health care that they need to address their comorbidities. But WPATH doesn't have any interest in what's actually best for these children. Their interest is forcing doctors across the country, whether it's therapists, whether it's counselors, whether it's psychiatrists, whether it's medical doctors, forcing these doctors to push children towards transing, hormones, and then irreversible surgery.